Hi, I'm Colleen Hutchinson. I'm here at the 18th Annual Minimally Invasive Surgery Symposium at the Wynn Encore Las Vegas. I have here with me today Ted Adams. Ted, thanks for being here.
Thank you, Colleen. And I'm with the University of Utah Department of Medicine as well as Intermountain Healthcare in Salt Lake City. I've been involved for a few decades with obesity research, particularly relating to the genetics of human obesity as well as bariatric surgery, long-term clinical outcomes.
So the first time that I worked with you was back in 2011 on the Miss Proceeding supplement that Ethicon had sponsored coming out of this meeting. And at the time you shared published 2-year data and then 6-year data that you were working on. How would you characterize your findings over time since then?
First of all, we've been very fortunate to have a number of patients who have been willing to continue to come to our center for follow-up testing, and we've had a high follow-up rate, over 90%.
That's amazing.
We've been following about 1,156 patients over the last 12 years. The change in clinical outcomes have been very interesting from 6 to 12 years, particularly with weight loss. We saw a 7% increase in percent weight loss among the surgery group from 2 to 6 years, but from 6 to 12 years there was almost no change.
Really?
So the leveling off, as it were, of weight loss for the gastric bypass patients, pretty impressive.
Okay. Does any of your current long-term data include findings that would have surprised you back in 2011?
I was not expecting as many of the control group patients who had been denied surgery at the onset of the study to have gone on to have gastric bypass surgery. There were about a third of the 420 patients that went on to have surgery, and we've followed those as well as part of our study. That is, when they had their surgery, we didn't drop them from the study, but continued to bring them to our clinic for the periodic testing.
Okay. So in your current data, how does weight loss durability compare to diabetes remission durability?
The durability of weight loss, as I already mentioned, pretty impressive. 35% reduction at 2 years, and then 28% at 6 years, and as I mentioned, close to 28% at the 12 years. So durability of weight loss, very good. Diabetes durability, in terms of the remission of diabetes, at 2 years it was about 75%, and dropped to about 64% at 6 years, and at 12 years it was 51%. We didn't see a real strong correlation, however, with the weight loss and the diabetes remission. It was a little more closely linked to how long the person had diabetes prior to their surgery, whether or not they were taking insulin prior to their surgery. Those on insulin were less likely to remit, and but the weight loss or weight regain was not closely correlated.
Okay. How would you say your study compares to the findings in the Swedish obesity study and the veteran Arterburn study?
The durability of weight loss, when we compared our results to those 2 studies you've mentioned, Colleen, very, very similar. The percentage within 1 or 2% out to 10 to 12 years. So very close in terms of durability. Our diabetes remission at 12 years was a little more favorable than the Swedish obesity subject study, and I believe this was because most of their patients had a procedure that's no longer performed, and our subjects were all gastric bypass surgery. So I think it was procedure related. Ours was about 50%, theirs 25 to 30%, as I recall.
Okay. And what would you say are the benefits beyond weight loss and diabetes remission for surgery patients?
I was impressed with the increased mobility that the patients have following surgery long-term. As part of our study, we included a maximal exercise treadmill test, and the improvement from pre-surgery to post-surgery, pretty remarkable. People obviously with less weight are able to be more active, and so quality of life generally in terms of how they feel from a health point of view very much improved.
Okay. And where do you stand with follow-up to this?
We're visiting as we speak with the National Institutes of Health about the possibility of doing a 16, 17-year follow-up study. That would require them funding it, and that's not certain at this point. There are a couple of areas that we would particularly like to look at on an even longer-term basis, one of which would be bone mineral density, osteoporosis. No one has really looked at that real carefully out that far, and so that's one area that would maybe like to explore.
Okay. How do you get such good follow-up at 90% over that many years?
Interestingly enough, the people in Utah are pretty supportive of research. They're interested in not only learning more about their own personal health and following up with that, but many of the participants expressed interest in their posterity. In other words, they want to help with research that might lead to improved health for their children and their grandchildren. Also, people tend to not move very often out of our state, so having them remain in the area and being able to contact them and visit with them on a regular basis, I think that was a real key to the success of the follow-up. I might say also, for those who were unable to attend our clinic, we, through their consent, were able to access electronic medical records because, again, the people live in the area, so the health systems with their electronic medical records provides us with additional opportunity for follow-up.
Do you have specific case managers on specific patients with follow-up?
No. We have 2 or 3 individuals who have been with us almost throughout the whole study that know the people individually and know them quite well.
Yeah.
And all of our investigators have been pretty consistent throughout the study, so I think that has helped.
That's great. Well, thank you for being here today and for sharing these insights. We really appreciate it.
Thank you, and I appreciate visiting with you today.
Thank you.